On the other hand, 430 under 5 years have been confirmed positive, with 2 dying within this age group. So you can see from these figures that, in fact, the proportion that die is very low, in line with what has been observed in other places. And since we're talking about children today, I want to discuss the issues surrounding welfare and formation of infants and children, as well as their growth and development from the time they are born. Globally, child survival remains an urgent concern. The first 28 days of life is the most vulnerable period of a child's survival. Children face the highest risk of dying in their first month of life. The global neonatal death rate is 18 deaths per 1,000 live births. And about a third of all neonatal deaths tend to occur on the day of birth and close to 3/4 in the first week of life. These findings suggest that focusing on the critical periods of birth and that immediately following birth is essential to save more newborn lives. In our country, under 5 mortality decreased by 50% since 1990. Neonatal mortality, on the other hand, has remained stagnant and as of 2014 stood at 22 per 1,000 live births. A more recent estimate by the UN Interagency Group for Child Mortality indicates that our neonatal mortality rate in Kenya rose to 29 per 1,000 live births in 2018. Not a very good indicator, an indicator that we need to work hard on in bringing down the number of neonatal deaths. Newborn deaths now account for 42% of all under 5 deaths and 56% of all infants. The main causes of neonatal mortality include intrapartum complications, birth asphyxia, which accounts for 31.6% of the deaths, prematurity, which accounts for 26%, and infections, which accounts for 15.8%. Other causes take up the 28%. There are various interventions that have been put in place to deal with these causes. First, with regard to intrapartum complications or birth asphyxia, efforts have been made to ensure availability of the basic resuscitation equipment in all facilities offering delivery services, items such as bag and mask, thermal heaters, enough warm towels, and other materials. We're also working together on ensuring proper care, comfort, and monitoring of mothers in labor to reduce incidences of intrapartum complications. The Ministry is also advocating for the establishment of newborn units in all Level 4 and Level 3 facilities to decongest county referral hospitals and Level 5 hospitals. To improve survival rates of premature children, we are scaling up the kangaroo mother care intervention in all counties, with at least a minimum of 3 facilities in each county able to offer this service. Currently, kangaroo mother care is practiced in 31 counties. Efforts are also being made to ensure proper follow-up of discharged preterm babies until they attain 2.5 kilograms. The Ministry of Health has developed newborn care guidelines for hospitals and lower-level facilities to offer guidance to new mothers. At the same time, we are ensuring availability of training materials on essential newborn care for pre-service and in-service, as well as inpatient newborn care register for capturing newborn data within the unit. We have also introduced the use of 7.1% chlorhexidine digluconate for umbilical cord care. At the county level, we have placed a child health focal person to advocate for the scale-up of newborn care interventions. We are also providing technical support to the counties through trainings, mentorship, and support supervision on newborn care interventions. However, all these efforts have not gone without their challenges. First, there have been slow scale-up of key interventions such as the kangaroo mother care, as well as utilization of the 7.1% chlorhexidine digluconate. Secondly, there has been inadequate support supervision, mentorship, and capacity building to the counties due to limited resources, among others. Early childhood development covers children aged 0 to 8 years old. Nurturing care for early childhood development focuses on the period from pregnancy to age 3, because it is scientifically proven that this is a very sensitive period for brain development. Yet in many settings, this period is not usually addressed in programming for early childhood development. In these earliest years, the health sector is uniquely positioned to provide support for nurturing care. From age 3, children move into more formal preschool settings where the education sector plays a pivotal role. Nurturing care for early childhood development recognizes that optimal development results from interventions in many stages of life and focuses on the period from pregnancy to age 3 in order to draw attention to the health sector's extensive reach and to make use of it. Nurturing care is the set of conditions that provide for children's health, nutrition, security, and safety, responsive caregiving, and opportunities for early learning. Nurturing children means keeping them safe, healthy, and well-nourished, paying attention and responding to their needs and interests, encouraging them to explore their environment and interact with caregivers and others. Turning to our COVID-19 situation in the country, today 193 people have tested positive, following the testing of 3,381 samples over the last 24 hours. This now brings the number of cumulative positives in the country to 32,557, and our cumulative tests to 425,364. The 193 cases being reported today are all Kenyans except for 3 who are foreigners. 137 are males, 56 are females. The youngest is a 2-month-old infant. The oldest is 87 years. The distribution of cases by counties is as follows: Nairobi 78, Embu 24, Garissa 21, Kiambu 18, Nyeri 13, Mombasa 10, Samburu 6, Murang'a 5, Lamu 4, Kajiado 3, Trans Nzoia 2, Kilifi 2, Machakos 1, Isiolo 1, Tharaka Nithi 1, Meru 1, Nyandarua 1, Uasin Gishu 1, and Nakuru 1. Let's look at the sub-county distribution of the 78 cases in Nairobi. These are in Kamkunji 9, Embakasi East, Langata, Makadara and Westlands 7 cases each. Dagoretti North and Embakasi South 6 cases each. Embakasi West, Kasarani and Kibra 4 cases each. Embakasi North, Roysambu, Ruaraka and Starehe 3 cases each. Dagoretti South and Embakasi Central 2 cases each. And Madare 1 case. The 24 cases in Embu are all from Manyata, while the 21 cases in Garissa are all from the Garissa town. The rest of the breakdown of distribution according to sub-counties is given in the document that you will receive. On a positive note, 225 patients have recovered from the disease. Of these, 188 have been discharged from the home-based care program, while 37 have been discharged from various health facilities that they have been receiving care. The total number of recoveries now stands at 18,895. And I want to thank our healthcare workers for this great achievement. On a sad note, we have lost 6 patients to the disease, bringing our fatalities to 554. And our sincere condolences to the families and friends of all those who have lost their loved ones. I thank you. Asanteni.
Nancy Okware kutoka KBC. Wahudumu wa afya wamekuwa na changamoto, hususan migomo ambayo imekuwa ikishuhudiwa hapa katika kaunti ya Nairobi, na vile wengine wametoa ile ilani ya kugoma baada ya pengine siku 21. Je, kama wizara ni kipi ambacho mnafanya ili kushughulikia maslahi yao? Maanake imekuwa mkitoa ahadi lakini bado wanasema ya kwamba ahadi zenyu hazijatimizwa. Hivyo basi kama wizara ni kipi ambacho mnapanga kufanya? Asante.
Nayoma Sampao from NTV. My question is, how far is investigations into the COVID-19 millionaires issue? And then my other question is concerning the latest statistics reveal that we've been recording fewer cases. What is the explanation to that? And could the lack of reagents be a contributing factor?
For what? Decreasing numbers?
For the reduced numbers.
Elfas Lagat from Citizen TV. Dr. Rashid, I have a question regarding return to sports. The last quarter of between September and October, there is the proposal to have sports return and active participation in sports. How, as a ministry, have you laid out a return to sports? And again, there is the explanation that there needs to be testing, and also is going to actually bear the cost of testing. Is it the sportsmen? Is it the government? Please elaborate on that. And then another question to Dr. Amoth is regarding the projected number in September. The ministry has always said that September is the month that we will see a peak in Kenya. Perhaps if you can tell us if there is a new model that you're using to base on those numbers, and if you can also tell us those numbers. And also a further addition to what Sampao has asked, is it a question of less reagents? Have you received more reagents? Because we're seeing increasingly reduced numbers, now 193. You can also please elaborate on that. Thank you.
Sada Hassan from KTN. My question is on, you keep on saying in the last 24 hours you've tested these samples and you've seen this number of results. So we know for a fact that these samples are usually brought up together and then maybe a day or two, and then now the results are announced. So is there So these examples, these samples, when were they actually tested, and when were they collected? And then now the second question is, what measures have you put in place to ensure that we've seen a reduction in the backlog? Because across the country, we know that there's a backlog of these samples that have been collected, and we know in some counties that it takes up to 2 weeks to actually get the results. So, and by the time the results are coming in, they're not useful. Thank you.
Okay, thank you. There was a question regarding the 21-day strike notice that certain healthcare workers have given. As a ministry, our aim, especially during this COVID pandemic, is to ensure that our response to the COVID pandemic does not falter. And it will falter if the most prized element of this response, who are our healthcare workers in the front line, decide to down their tools. So ours is to appeal to our healthcare workers to be able to continue to render these important services at this critical time, but at the same time enter into dialogue on the grievances that they may have. And I can assure you that as a ministry, we are working together also with the counties and the aggrieved parties in trying to address these grievances. And there are discussions ongoing. The ministry will be putting it in its effort in trying to diffuse this situation and to avert this strike, because we cannot afford to have a strike at this point in time. And again, to our healthcare workers, it's not the right time for us to be able to engage in this type of unrest when we have serious concerns about saving people's lives in this pandemic. I will not comment on the issue of the COVID-19 billionaires, as you called it, because that matter is, I'm sure, receiving the attention of the right agencies and institutions that will be looking into it. So that is not an area that I would want to comment on. The reduced number of tests, and I think we have said before that first, the tests that we are reporting today are samples that were collected over the weekend, and generally we do see that following a weekend the number of tests are low. But having said that, we have in the last week been testing lower than what we had the previous week. And the reason is that it depends upon the supply chain and the reagents that we have. We do get these reagents. We have organized to get it on a regular basis from our suppliers, and I think they have been able to maintain that over the last several weeks, that have seen our testing numbers really go up. But now and then we might have a challenge in this supply chain, and that is when you see us having lower numbers of testing. But we are expecting a consignment of tests anytime now, and as soon as that arrives, we shall still go back to our figures of before, or maybe even higher, as we continue with our testing. Alphas Langat, it is not only sports, I think, that wants to come back and be active. There are many areas within our social and economic life that we want to normalize and bring back to normal. Of course, in doing this, we must be informed by where we are in terms of our pandemic. And you have seen the progressive easing of measures as we have moved forward in some areas. And I'm sure that when the time is right and when we have the advice of experts as to what we can do in terms of the measures, those measures will be addressed at that time. And it's schools too. The discussion is around schools as well. Should schools reopen, and when do they reopen? How do we reopen? Is it going to be a phased process, and so on? As regards sports that will bring together a lot of people, gatherings in stadia, I think still remains a concern. If we were to talk about soccer or things where you have a lot of fans coming into the stadium, we need to have the proper measures also instituted in that place. If we have to resume these sports, then we must also put in place the right measures to ensure that there is social distancing and wearing of masks and all these other procedures. I have seen this happen in other countries doing that. In many other countries, sports have resumed, but they are being done on a virtual basis, people watching from the comfort of their rooms. So I think we will address that as we move forward. The last 24 hours, when we say the last 24 hours of testing, indeed what we mean by that is that samples have been collected, and usually they are collected. The program of collection of samples is that once they are collected, they are shipped to a lab. If they are collected during the daytime hours, they are then shipped to a lab in the evening, and then they are tested from there. Those are the 24 hours we talk about, because the following morning the results are ready to be presented. And by and large, that is how we have operated. However, on occasion, of course, there will be a backlog. And when there is a backlog, then preferences obviously has to be given to those samples that arrived earlier, for the reason that we need to test those samples. You can't keep samples for too long, otherwise they will not be of great value. So backlog challenges now and then do appear, but by and large we do try to clear the samples that we get within that 24-hour period and return the results. And remember that we are testing in very many laboratories, and quite a good number of them are here in Nairobi, but we have also built capacity now in many of our laboratories across the country, in Kisumu, in Kericho, in Mombasa, in Kilifi, and then those results can then be relayed electronically to the center here for reporting. So I think that sums up the questions, but I will ask DG to say one or two words, perhaps.
Thanks, Waziri. In addition to what CS has told us, is that today morning we had a meeting with the Council of Governors, the Kenya National Union of Nurses, the Kenya Clinical Officers Union, and the Kenya Medical Practitioners and Dentists Union, in view of the strike notice that was issued. We have had very fruitful deliberations. Some of the issues date back to more than 5-6 years ago. And we have agreed that going forward, this is a time for us to come together as a country. And we'll be able to have a follow-up meeting next week on Tuesday to be able to see how we can be able to mitigate against this intended strike. So discussions are ongoing, and we are making good progress, and we believe we'll reach a compromise on the best way forward to safeguard the gains that we have made since we started fighting this pandemic in March. Lagat asked a question about the testing and the projections. Yes, as Waziri says, we have more than 34 labs now testing for SARS-CoV-2 spread throughout the country. But for the past 1 week or so, you have noticed a decreasing positivity rate, which as of today stands at 6%. So that is, you are making progress, but you have not hit the magical 5%, which we need to hit and sustain for 2 weeks before we can actually say that we are flattening the curve. So our projections are in line with what we told you early in March, April, that the pandemic will peak in late August, September, and empirical data that we are seeing is pointing to that figure, but it is too early to conclusively come to address this matter as at now. So the next 3-4 weeks will be critical to be able to tell us whether we hit the magical 5% and we sustain that positivity rate for 2 weeks, in which case we can conclusively say that we have flattened the curve, and therefore we can be able to lift the remaining measures. The question regarding sports, we have worked very closely with the Ministry of Sports in development of guidelines and protocols to ensure safe resumption of sporting activities without danger to the sportsmen and women and also to the public. And some of these protocols will, of course, ensure that there will be no spectators or audiences in these sports, but people can be able to watch virtually through TV broadcast or through the internet. Yesterday you watched the Champions League final in Lisbon, which was a virtual thing, and we all watched it all over the world. We can as well be able to do that in Kenya, in athletics, in football, and all other areas of sports where we'll continue to excel. Thank you.
Thank you.